My name is Jack Rychik. I am the director of the Fetal Heart Program at the Cardiac Center of the Children's Hospital of Philadelphia and professor in pediatrics at the University of Pennsylvania School of Medicine. I found cardiology to be the most fascinating of the different subjects and perhaps the most challenging. And once applying myself to understanding in particular the different variations in the way the heart can be built from a congenital standpoint, I found that to be very, very gratifying, and it made sense to me. Both Jiu Tien and I have been at the Fetal Heart Program at the Cardiac Center for over 10 years. In our experiences at Children's Hospital, we have had hundreds of different cases that are presented to us with what we at the time considered perhaps every single possible permutation of congenital heart disease. I think what we found is as we continue forward, there still are many, many more differences in how the heart can be built. It was simply a matter of looking at our collection and our library and realizing that we had a huge number of fascinating cases that we needed to share with the community in large. And that's what prompted us to begin thinking about putting together a collection and cataloging these variety of videos, these variety of images, and having an accompanying textbook that could provide data and information concerning fetal cardiovascular disease. So our text, Fetal Cardiovascular Imaging, I believe will be valuable to a wide variety of different disciplines, and it really is a text that will be of interest in a hybrid manner. It focuses on cardiology, but it's cardiology within the prenatal realm before you are born. So pediatric cardiologists will be interested, obstetricians and maternal fetal medicine specialists who deal with diagnosis of pregnant women who are carrying fetuses with birth defects, radiologists and sonographers who specialize in prenatal imaging, the community of pediatric surgeons who deal with repairing congenital heart disease, I think will have an interest in our assessment of things from the very beginning, because in fact many, many more patients now are detected before birth with complex heart disease than they are after birth. So this is a type of text that will be attractive to primarily the obstetrical and maternal fetal medicine community, as well as the pediatric cardiology community. Diagnosis of congenital heart disease before birth is so essentially important to good outcomes in the current era. Perhaps 15, 20 years ago, babies with birth defects of the heart would present after birth with being ill, and if they were fortunate enough to be identified, then they might come to a tertiary care center that could manage their complex disease. Today it's a completely different era. Women want to know not just the gender and the number of pregnancies, number of gestations that are present, but knowing at 18 or 20 or 22 weeks exactly what the makeup of the heart disease is critically important. Knowing about it allows one to prepare in anticipation of delivery of a child who's going to need special services, and it has been demonstrated that prenatal diagnosis does result in a much better outcome for not just the short-term, but the long-term survival of the patient. Well, putting this book together has been a huge but incredibly gratifying challenge. It does sum up our current knowledge and experience in dealing with fetal cardiovascular disease. This is a quickly moving and developing discipline. It is a discipline that does cross many different departmental specialties. And I do believe that our particular contribution will be of interest to folks who deal with the fetus from all different perspectives, whether it's maternal fetal medicine, obstetrics, or cardiology.